New questions today about what might amount to a bailout for insurance companies. We're going to examine the use of that word in just a moment, bailout. There's a little talked about provision in ObamaCare that provides reimbursement for insurance companies. And these cost offsets, that's what they're called, cost offsets or risk corridors, were put in place for insurers who may incur more costs for complying with the law. Put simply, if the costs were higher than expected, the government could be on the hook for the excess. How much money? That remains unclear right now, and some wonder if the president's fix will trigger higher risk corridor payments. Florida Senator Marco Rubio says he's working to repeal this provision designed to protect the insurance companies if more high-cost patients sign up. In the meantime, hundreds of thousands of Americans who got letters canceling their insurance could get new letters from their insurance companies uncanceling those policies. So what is happening and how much is it going to cost us? That's a question for James Capretta. He's joining us, a senior fellow at the Ethics and Public Policy Center. James, it's nice to have you on the program with us. Let's take it bit by bit, because bailout, even coming out of this recession, certainly brings up a lot of strong feelings. Bailout, risk corridors, what are we really talking about here? Why are insurance companies getting any money from the government?
Well, this is a provision that said if an insurance company lost more than a normal amount, and the target is like 3% around their premium collections, if they lose more than that, then the government steps in and pays for some of the excess costs. And if it's above 8%, the government pays, in fact, almost all of the excess costs.
Now, why would the law be set up that way? Why would the government want to do that?
Well, it was to induce the insurance companies to participate in the marketplace. They were trying to say to the insurers, don't worry, come into the marketplace. If you lose a lot of money in the first couple of years, the government will pick up a lot of the losses. Now, this was supposed to be balanced with another provision that said if you made more than expected, you paid into the pool. So it was supposed to be winners and losers balancing against each other, so it would be net neutral to the federal government. However, if, as one now expects, that the pool of people is much sicker than anyone anticipated because of all the problems, then you're going to have almost all the insurers would lose money, at which point the government would pay out more than they expected.
What about the medical device tax? What about the penalties, or really the taxes, on Americans and companies that don't comply with the law? Could those taxes counteract the money that would be going to insurance companies?
Well, it was all supposed to be part of a big pool of money, yes. So they collected taxes from various industries to cover the cost of the new subsidy structure and the various other spending, the Medicaid expansion in the law. This risk corridor provision was supposed to be basically a zero provision that didn't cost the federal government any money. What's happening now, what Senator Rubio and others are realizing, is it's actually going to cost a lot of money, because in 2014, the risk profile is going to be much worse than they thought at enactment. And therefore, the payouts from the federal government will far exceed any clawback that they might get from people getting excess profits.
In my research,
so the risk corridors is going to be a big loser for the federal government.
And the question then becomes how much. And in my research, I haven't been able to really nail down a number. Senator Rubio's folks said they're talking to the Congressional Budget Office to try to figure it out. But James, have you heard of any estimates? I mean, what could this actually look like?
No, we don't know yet. It's too early to tell. The Congressional Budget Office and the Office of the Actuary inside the executive branch, inside the Department of Health and Human Services, will have to re-estimate the law based on all the problems that have occurred in the last couple of months. All of that will occur early next year when they do new budget numbers. At that point, we'll get a better idea whether CBO thinks the risk corridor provision will end up being in the billions of dollars, which I fully expect it to be.
So then what is your thought process about this potential legislation coming from Senator Rubio? Is it necessary at this point? If these provisions are only in for the first 2 or 3 years, then is it something to wait and see? How do we even address this issue given some of the changes, including those that we saw last week, the fixes that are being proposed?
I think Senator Rubio's legislation is motivated by the same motivation I have, which is that really what we ought to be doing is not bailing out this whole system with more taxpayer funding, but moving in an entirely different direction. I think the provision is, really raising the question, why are taxpayers on the hook for a fiasco of a rollout? And that's really what this means. If this thing goes very, very badly, the losers are the taxpayers. We end up paying more money to the insurance companies to cover their losses, which I think most taxpayers will find unpleasant.
So the portrayal of this being a blank check with an unknown amount is an accurate portrayal from what we know at this time?
Yes, it is. It could be in the very large billions of dollars being paid out under the risk corridor provision. Absolutely.
Risk corridor. That's going to be a word. I think a phrase we're going to hear a lot of.